Men over 60, a urologist reveals the 3 secret pressure points for stronger morning wood gentlemen. I want you to imagine something.
I want you to
imagine waking
something.
up tomorrow morning and feeling that firm, confident readiness, something you maybe haven't experienced in months or even years.
A urologist
I'm not
reveals
talking
the
about
3
clutching
secret
some little
pressure
blue pill
points
that can
for
cost you over
stronger
$50 a
morning wood.
pop. No awkward pumps hidden in a drawer. And definitely no expensive treatments that promise the world but ultimately drain your savings. Now most men think the problem is that their body
and
is
perhaps more importantly,
broken. Those
where
things just don't work
exactly
anymore.
is it?
But what if I told you that's not true? The problem isn't that the system is broken. It's that the system simply needs a more direct, hands-on wake-up call. And that power, it's literally in your own 2 hands.
Hidden
Look, what
in
I'm
a
about to
drawer,
share with you
and
isn't some
definitely
internet
no
myth or wishful
expensive
thinking.
treatments
It's based
that
on
promise
real
the
anatomy,
world,
on
but
real nerve
ultimately
pathways,
drain your
the very
savings.
things we urologists spend years studying. You see, erections are just a carefully coordinated conversation between your brain, your spinal cord, and your blood vessels.
I'm not talking about clutching
And
some
with
little
age,
blue pill that can cost
conversation,
you over $50 a
it just gets a
pop.
little sluggish. Today, we are going to wake it up. I know this works because I've seen it firsthand. I've seen
Imagine
it work
waking
for
up
so many
tomorrow
of my own
morning
patients.
and feeling that
Men who
firm,
walked into my office thinking their
confident
best days were
readiness,
long gone.
something you maybe
They
haven't
learned how to work with their
experienced in
bodies
months
instead
or
of against
even
them.
years.
I'm Dr. Audrey Wells, and for more than 15 years, I've helped men just like you reclaim their morning vitality. In this video, I'm going to show you exactly where 3 secret pressure points are located. I'll show you how to stimulate them correctly, and explain why this simple 5-minute routine can bring back that morning confidence you thought was gone for good. All right,
It's that the
let's get
system
right into the
simply
practical
needs
application.
a more
We're going to start with the
direct,
foundation of this
hands-on
entire
wake-up call.
technique, the very first step in reawakening your body's natural systems.
And that
Pressure
power,
point number 1.
it's
The base
literally
groove,
in your own
the
2
ignition
hands.
switch. Now, what is this spot? And perhaps more importantly, where exactly is it? It's precisely what it sounds like. It is a small, subtle groove located right where your manhood meets your body, almost like a natural seam on the underside. The tissue here often feels slightly different, a little firmer, a little
The very
more
things
textured
we
than the rest of the
urologists
shaft.
spend
To find
years
it with
studying.
certainty, just gently run your finger along the underside, heading from the tip back towards your pelvis. Just before you reach your body, you'll feel that slight indentation, a transition point. That specific groove, that is your target. It's the anatomical landmark we're going to focus on first, and for a
I
very
know
good
this
reason.
works because
But right
I've
here,
seen it
we
firsthand.
arrive at the critical mistake that almost every single man makes. And frankly, it's a
I've
mistake
seen it
that is
work for
completely
so many
understandable
of my
given the
own
information we're
patients.
usually fed. This entire foundational area is almost completely overlooked.
Men
Most
who walked
men,
into
and
my
even many
office
doctors in
thinking their
general
best
practice,
days
tend to
were
focus
long
only
gone.
on the main shaft or the head of the organ.
They learned how to
They
work.
treat the entire structure as one single piece, not realizing that this small, very specific zone at the base is a
I'm
crucial
Dr.
meeting
Audrey
point,
Wells,
a command
and for
center.
more than 15
Ignoring it
years,
is like trying to start
I've
your
helped
car
men
without
just
ever
like
putting
you
the key in the
reclaim
ignition.
their.
It's like trying to turn on a lamp without plugging it into the wall. You can flip the switch all you want, but without
Almost
that
like a
initial
natural
connection to the
seam
power
on the
source,
underside.
nothing
The
significant is
tissue
going to
here
happen.
often
You are
feels
missing the first and arguably the most important step in the entire sequence of events. So, why?
and
Why is
explain
this
why
little
this
spot so
simple
incredibly
5-minute
powerful?
routine
Why
can
do I
bring
call it
back
the
that
ignition
morning
switch?
confidence you.
The answer has everything to do with what lies just a few millimeters beneath the surface of the skin. This
All
area
right.
is a true
Let's
anatomical
get
hub,
right
a master
into
junction
the
box where 2
practical
of your body's most
application.
critical systems intersect. First, let's talk about the wiring, your nervous system. This area
just before
contains
you
a dense,
reach your
incredibly
body,
rich
you'll
network
feel
of
that
sensory
slight
nerve endings.
indentation.
These aren't just any nerves.
A
They are highly
transition
specialized
point.
nerve bundles,
That
including critical
specific
branches of the
groove.
dorsal
That
nerve, which is the primary
your-
nerve responsible for sending arousal signals from the penis directly to the spinal cord and up to the brain.
It's the anatomical
Second,
landmark
let's
we're going
talk
to
about the
focus
plumbing.
on first.
Your circulatory
and for a very
system.
good reason.
The base groove sits directly on top of a major junction for the blood vessels, specifically the arteries, that feed directly into the erectile chambers. Those
And
spongy
frankly,
tissues inside,
it's a mistake
known as the
that is
corpora
completely
cavernosa,
understandable
are what
given
fill with
the
blood to
information
create
we're
firmness.
usually fed.
So at this one
entire
single point,
foundation
you have the main electrical wiring running right alongside the main fuel line. By stimulating this one spot, you are simultaneously sending
Most
a powerful
men,
wake-up call
and
to your
even
nerve
many
pathways
doctors in
and
general
signaling
practice,
the gatekeeper of your blood
tend to
vessels
focus
open wide.
only on the main
It's a two-for-one
shaft or
benefit
the head
that
of
you
the
simply cannot
organ.
get by focusing on any other area. And please, understand that this is not just a theory or some ancient mystical belief. The
A
principles of
command
neurostimulation
center.
and
Ignoring
circulatory
it
response
is like trying
are
to start
incredibly
your
well
car
documented
without
in modern
ever
medical
putting
literature.
the key in
For
the
instance,
ignition.
a key study published in the Journal of Andrology back in 2021 explored the direct
It's like
effects
trying to
of
turn on a lamp
localized
without
stimulation
plugging it into the
techniques
wall.
on blood flow in men experiencing circulatory difficulties. The researchers, using advanced Doppler ultrasound to measure blood
You are
movement,
missing
found that
the
targeted,
first
gentle
and
massage on these
arguably
specific
the
neurovascular
most
bundles,
important
the very spots
step
we are talking
in
about
the
right now,
entire
led to
sequence
a
of
measurable
events.
increase in penile blood flow velocity in over 60% of the study's participants. So, what does an increase in blood flow velocity actually
The
mean
answer
for
has
you sitting
everything
at
to
home?
do with what
It means
lies
the blood
just a
isn't
few
just trickling
millimeters
in.
beneath
It's
the
arriving
surface of the
faster,
skin.
with more force and with more purpose. This provides powerful clinical evidence for what we're doing. The science is clear. When you
Which is the
stimulate this
primary
area
nerve
correctly, you are
responsible
sending
for
two
sending
distinct
arousal
and powerful
signals from the
messages to your
penis
body.
directly
Message
to the
number
spinal
1,
cord
wake
and
up
up
the nerves.
to the
And
brain.
message number 2, open the floodgates for blood. To make this concept really, really simple and easy to remember, I want you to hold on to this analogy.
Second, let's
Think of the
talk
base
about the
groove
plumbing,
as the
your
ignition switch for your
circulatory
car.
system.
The engine, which is your erectile tissue, has all the potential power it needs to run smoothly
The
and
base
strongly.
groove sits
The fuel tank is
directly on
full.
top of a
The battery
major
is
junction
charged.
for the
But
blood
that
vessels,
powerful engine will
specifically
remain dormant,
the artery.
silent and cold, until you perform one specific action. You have to turn that specific key in
Those
that specific
spongy
spot.
tissues
This pressure
inside,
point
known as
is
the
key.
corpora
The pressure
cavernosa,
from your thumb
are
is
what
the
fill
action
with
of turning that key. It's the catalyst that starts the entire chain reaction. So, how
at
do you do
this
this correctly,
one single
safely
point,
and effectively
you
to get the
have
best
the
possible
main
results?
electrical
I want you to
wiring
follow these
running
instructions
right
precisely.
alongside.
It's very simple. First, get into a comfortable position, either lying down in bed or sitting relaxed in a chair.
By
Second,
stimulating
it can be
this
helpful
one
to warm your
spot,
hands slightly
you
by
are
rubbing them together.
simultaneously
A cold
sending
hand
a
can cause
powerful
tissues to
wake-up
constrict,
call.
which is the opposite of what we want. Now, position the pad of your thumb directly over that base groove, while your
It's
other
a
fingers gently
two-for-one
support the
benefit
shaft
that
from
you
behind.
simply
I
cannot
want you to
get
start with
by
moderate
focusing on
pressure.
any
To
other
gauge this,
area.
think about the pressure you would use to press a button on an elevator. It should be firm enough to feel the underlying tissue and make a solid connection.
And please
but it should
understand
never, ever
that
be
this is not
to the
just
point of
a
sharp
theory
pain or discomfort.
some ancient
This is about
mystical
stimulation,
belief.
not punishment. Then, with that steady pressure, begin making small, slow,
The engine,
and very
which is your
deliberate
erectile
circles
tissue,
with your thumb.
has all the
The
potential
circle
power it
shouldn't be
needs
much
to run
wider than the tip of
smoothly
your thumb.
and
This
strongly.
is precise work. Feel the warmth from your hand begin to spread through the area. Your only job here is to maintain that
You have
gentle
to turn
circular
that
motion.
specific key
You're going to
in
do
that
this for about
specific
90 seconds.
spot.
Just a minute and
This
a half.
pressure point.
As you work, pay close attention to the sensations. You might begin to notice a pleasant warmth
It's the
or a very
catalyst
subtle
that
tingling
starts the
sensation.
entire chain
Some men
reaction.
describe it as a faint buzz or a sense of fullness starting to develop in the area. These are all positive signs. That is your body telling you that blood flow is increasing and your nerve endings are waking up. Now, if you don't feel much at first, please do not worry and do not get discouraged. For some men, especially if circulation has been sluggish for a long time, it can take several days or even a week of consistent practice to heighten the sensitivity in this area. Consistency is what matters most. I remember a patient of mine, David, a 68-year-old retired firefighter. He'd come into my office, arms crossed, with a look on his face that told me he thought this was all hocus pocus. He said, "Doc, with all due respect, I've tried everything. I don't see how rubbing one spot is going to change anything." But he was a good sport, and he promised me he would try it diligently for 1 week. He called my office just 6 days later. He didn't even make a follow-up appointment. He just wanted to tell my nurse something. And she wrote down his exact words for me. He said, "Tell the doc it was the first time in nearly a decade I felt a hum of life down there in the morning when I woke up." A hum of life. That's what this can do. That's what. And here's a little synergy tip he discovered, one that I now recommend to all of my patients. Try doing this routine in a warm shower. The heat from the water acts as a natural vasodilator, which means it helps your blood vessels relax and open up even before you begin. This primes the entire area, making the stimulation from your thumb that much more effective. It's a very small tweak, but it can make a world of difference. If you understand the power of this ignition switch and you're ready to finally turn the key on your own health, I want you to comment on the word switch down below in the comments section. Let me know that you're with me on this journey. Now that we've turned the key in the ignition with the bass groove, it's time to engage the engine and the transmission system of the body. This crucial step is what translates that initial spark of energy into real, sustainable power. This brings us to our second and profoundly important anatomical area. Pressure point number 2, the perineum. The powerhouse muscle. So, what is the perineum? This is an area that might be completely new to many of you. It's a term we use in urology and physical therapy all the time, but it very rarely comes up in everyday conversation. And that's a real shame, because understanding it is fundamental to understanding your own body's mechanics. The perineum is that small, slightly soft and somewhat springy patch of tissue located in the space between the base of your scrotum and your anus. It's a very small piece of real estate, anatomically speaking, but its location is everything. To locate it precisely, the easiest way is to sit comfortably in a chair or lie back with your knees slightly bent and apart. If you place the tips of 2 fingers in that area, you'll immediately feel what I'm talking about. It's a distinct zone, a central soft spot separate from the surrounding structures. And right here, we come to a mistake that is even more common and arguably more impactful than ignoring the base groove. This entire region is the single most overlooked spot in all of male pelvic anatomy. For most men, it's terra incognita, an unknown land. It's often ignored entirely, seen as nothing more than space between 2 points. But when it comes to erection strength, control, and especially longevity, this small, unassuming area is an absolute powerhouse. Not understanding its function is like owning a high-performance car, but never learning how to shift it out of first gear. You might get moving, you might generate some initial speed, but you'll never access its true power, its torque, or its endurance. This spot is the secret to not just getting firm, but staying firm. So why? Why is this unassuming patch of tissue so absolutely vital for your performance and your long-term vitality? The secret, once again, lies just beneath the surface. The perineum serves as the roof, the external access point, to a group of incredibly important muscles that form your pelvic floor. But there is one muscle in particular that sits directly underneath this spot that we need to focus on. It's called the bulbospongiosus muscle. Now that's a clinical, complicated-sounding name, I know, but its function is actually very direct and simple to understand. This powerful muscle wraps around the base of the penis, right inside your body. During an erection, its job is to contract rhythmically and strongly. This contraction does two very important things in a coordinated sequence. First, it helps to push blood forward into the shaft, contributing to that feeling of fullness, pressure, and ultimate rigidity. And second, and this is arguably the most important part, its contraction constricts the deep dorsal vein of the penis. This is the primary exit route for blood. The muscle acts as a natural valve, a biological clamp. By squeezing shut this major exit route, it traps the blood inside the erectile chambers, which is the absolute non-negotiable requirement for maintaining a strong,
safely,
lasting erection.
and effectively
with age,
to get
and
the
especially
best.
with a more sedentary lifestyle where it's not actively engaged.
I want you to
this
follow
muscle,
these instructions
like any other
precisely.
muscle in your body, from your bicep to
very
your calf,
simple.
can weaken. Its tone can decrease. It can lose its responsiveness. A weak bulbospongiosus muscle means a weak clamp.
It can be
It means the
helpful to
valve
warm
doesn't
your
seal
hands
properly.
slightly by
And a
rubbing
weak,
them
leaky
together.
valve means that blood can escape too quickly, leading to erections that are either not as firm as they used to be,
Now,
or that fade
position
away
the
much
pad of your
faster than
thumb
you would like,
directly
which
over
can be
that
a source
base
of immense
groove,
frustration
while your
and
other
anxiety.
fingers
And the
gently
science on this
support
is
the
not
shaft
new,
from
nor is it
behind.
controversial. It is irrefutable. Pelvic floor health is a cornerstone of modern urological medicine. I want to
Pressure.
point to a landmark
Togo
study, a really
Hedis.
pivotal one.
Thing about the
Published in
pressure you
esteemed
would
British
use to
Journal of
press a
General
button on
Practice.
an elevator.
Researchers took a large group of men who had been struggling with erectile performance for at least 6 months. They put one group of these men
This
on a
is
dedicated
about
pelvic floor
stimulation,
muscle training
not
program. The
punishment.
results were nothing short of astounding. After just 3 months of this training, a full 40%,
and
that's
very
4 out of
deliberate
every 10 men in the
circles
study,
with your
had
thumb.
regained
The
completely
circle
normal,
shouldn't
natural
be much
erectile
wider
function.
than the tip
Another
of your
35%
thumb.
reported
This
significant
is
improvement in their
precise
performance and
work.
duration. That is a combined 75% success rate without a single pill, a single
Your only
injection,
job
or
here
a
is
single
to
invasive
maintain
procedure.
that gentle,
How did they achieve this?
circular
By
motion.
strengthening the very muscles that lie directly beneath the perineum. Applying targeted pressure to this area is a way to reflexively activate
As
and
you
essentially
work, pay close
wake up this
attention
powerhouse
to the
muscle,
sensations.
improving its tone and its mind-muscle connection over time. To help you visualize this crucial concept, I want you to use this powerful analogy. Think
Some
of your
men
erection
describe
like
it as
a
a
high-pressure
faint
tire
buzz
on a car,
or a sense of
getting the air
fullness
into the
starting to
tire.
develop in the area.
That's the job of good circulation. The healthy blood flow we worked on with the base groove. That's step 1. But if the valve on that tire is leaky, old,
Now,
and weak,
if you don't
the air
feel
will
much
just
at
seep
first,
right back out,
please do not
and the
worry
tire will
and do
quickly
not
go
get
soft, no
discouraged.
matter how much air you pump in. The bulbospongiosus muscle is that valve, and stimulating the perineum is how you manually tighten and recondition that valve, ensuring that once the pressure is in, it stays
Consistency
in.
is
So,
what matters
how do we
most.
do this correctly?
I remember a
How do we
patient of
tighten that
mine,
valve?
David,
The technique
a
is specific but
68-year-old
easy to learn.
retired firefighter.
You'll want to either be
He'd
sitting in
come
a
in
comfortable chair, leaning forward slightly, or lying on your back with your knees bent. This position helps to relax the area. Now,
arms
take 2
crossed,
fingers,
with
your
a
index
look on
and middle
his face
fingers
that
usually
told
work
me
best
he
together,
thought this was
and place
all
them right in
hocus
the center
pocus,
of the
he
perineum.
said.
You're going to press gently, but firmly. The pressure should be enough for you to feel the underlying muscle tissue respond, but it
he
should
was
not
a good
cause any
sport,
pain or
and
sharp
he
discomfort.
promised me he would
It's a
try
feeling
it
of deep,
diligently
focused
for
pressure.
1 week.
Once you've applied
He
that
called
pressure,
my
you're
office
going to move your fingers
just
in
6
slow,
days
deliberate,
later.
controlled circles. Stay centered in that sweet spot. Don't stray too far. This is not a broad message. It is targeted stimulation.
You can
As you
flip
perform
the
these
switch
slow
all you
circles,
want,
I want you
but
to breathe
without
deeply
that initial
and focus on
connection
the
to the power
sensations.
source,
You may notice
nothing
some subtle things
significant
happening,
is going to happen.
perhaps a gentle warmth that seems to radiate forward towards the base of the penis. Maybe you'll feel a faint, deep pulsing as blood
So
flow in the region improves.
Why is this
Those
little
sensations
spot
are your pelvic
so
muscles waking up
incredibly
and your
powerful?
circulation
Why
responding
do I call
to the
it the
stimulus.
ignition switch?
You're going to continue this for 3 to 4 minutes. This longer duration is important for truly stimulating that deep muscle
The
tissue.
researchers
Now,
using
here is a
advanced
synergy
Doppler
tip for those of you
ultrasound
who
to
want to
measure blood
maximize your
movement
results.
found that
Many of my
targeted
patients have reported incredible benefits by pairing this massage with basic Kegel exercises. A Kegel is simply the contraction of the muscles
gentle
you would use
massage
to
on these
stop the flow
specific
of urine
neurovascular
midstream.
bundles.
You can
The
perform a
very
few
spots we
slow,
are talking
controlled
about
Kegels
right now
before you begin the
led to a
massage to
measurable
wake up the area, and then a few more afterward. This combination doesn't just help in the moment. It actively trains the muscle to
So what
contract
does an
more
increase
powerfully
in
during
blood flow
arousal,
velocity
making your erections
actually
feel
mean for
fuller,
you
more dependable,
sitting
and
at
last
home?
significantly longer over time? This spot may be out of sight, but when it comes to restoring your youthful vitality
It
and
means
control,
the blood
it should
isn't
never,
just
ever be out of
trickling
mind.
in.
We
It's
have turned the
arriving
key
faster,
in the ignition.
with more force,
We have engaged the
and with more
powerhouse muscle that
purpose.
sustains the energy. Now, we come to the final step in this sequence. This is where we fine-tune the entire system for maximum
This provides
responsiveness.
powerful
This brings us to our
clinical
third
evidence
and final
for
pressure
what
point.
we're doing.
Pressure point number 3, the glans ring, or the corona, the sensitivity tuner. So what is the corona? Anatomically, it's the
science
formal
is clear.
name for the rounded,
When you stimulate
ring-like
this
ridge
area
at the base
correctly,
of the head of the
you are
penis,
sending
right
two
where the glans,
distinct
or the head, meets the main shaft. It forms a distinct raised border. This is one of the most prominent and easily
to
identifiable
make this
landmarks of the
concept
entire
really,
organ.
really
And from a
simple
neurological
and
standpoint,
easy
it
to
is
remember.
arguably the most
I
important.
want you to hold
Now,
on
we must
to
address
this
the
analogy.
most critical mistake men make when it comes to this area. And it's a mistake born from a complete misunderstanding of how this part of the body works. The mistake
But that powerful
is too
engine will
much
remain
intensity.
dormant, silent,
The error is
and
believing
cold
that more
until
pressure,
you perform
more
one
speed,
specific
or more
action.
friction is better. With the first 2 points, we were focused on deeper structures, blood vessels and muscles, but this area
The
is different.
pressure from your thumb
This area is
is
all
the
about the
action
delicate
of
and
turning
intricate
that
network of
key.
nerves that lie just beneath a very thin layer of skin. This final step is not about force. It is about finesse. It is about communication. Overwhelming the nerves here with aggressive stimulation can actually have the exact opposite effect you're looking for. It can cause the nervous system to become desensitized, to essentially tune out the signals, which is a defense mechanism to prevent overstimulation. We are not trying to shout at the nerves. We are trying to have a very clear, very precise conversation with them. So, why? Why is this specific ring so neurologically significant? The reason is concentration. The corona and the area just below it, called the frenulum, are packed with an incredibly dense concentration of specialized sensory nerve endings. Think of it as the neurological epicenter of the entire region. These nerve endings are the body's primary messengers for sending arousal signals directly to the sacral erection center in your spinal cord. When this spot is stimulated correctly, these messengers fire off signals that travel at incredible speeds, telling your brain and your spinal cord that it's time to initiate and sustain the erectile process. As men age, 2 things can happen. The raw number of these nerve endings can slightly decrease, but more commonly, their baseline sensitivity can decline. The signals they send might become weaker, or they might require a stronger initial stimulus to get going. What we are doing with this technique is gently reconditioning and resensitizing these crucial nerve pathways. And the science behind this is fascinating, rooted in the field of sensory neuroscience. Studies, like one published in the Journal of Sexual Medicine in 2022, have used advanced neurosensory testing to map the sensitivity of different parts of the body. They consistently confirm that the corona contains one of the highest concentrations of sensitive nerve fibers in the male body,
life down
second
there in
only
the
to
morning when I
fingertips
woke up.
and lips. The study demonstrated that specific types of stimulation,
And
namely
here's a little
patterned and
synergy
rhythmic
tip he
pressure,
discovered,
not just random
one that
friction,
I now
can heighten
recommend
the
to all
responsiveness
of
of
my
these nerve
patients.
pathways. By stimulating this spot with a specific, controlled rhythm,
The heat from
you
the
are
water
essentially
acts as a
retraining
natural
the nerves.
vasodilator,
You are lowering their
which means
activation
it helps
threshold,
your blood
making it
vessels
easier for
relax
them
and
to fire
open
the
up
signals that
even
lead from initial
before you
arousal
begin.
to a full and firm erection. To help you understand this delicate process, I want you to use a very specific analogy.
It's a very small
Think
tweak,
of your nervous
but
system
it
in
can
this
make a
area like an
world of
old
difference.
classic radio. If you want to hear the music clearly, you don't just walk up and crank the volume knob all the way to the right. That will just give you loud,
I
distorted
want you to
static.
comment on the word switch
Instead,
down below in the
you have
comments
to carefully,
section.
gently, and precisely turn the tuning dial.
Now
You
that
make
we've
small,
turned the key in
patient
the ignition
adjustments
with the
until
bass
you
groove,
lock onto
it's
that
time
clear,
to engage
strong
the
signal.
engine and the transmission
This technique
system of
is
the
how
body.
you fine-tune your body's arousal circuitry. You're not trying to blast it with volume. You are carefully adjusting the dial to get the clearest possible signal to your
This
brain
brings
and
us to our
spinal cord.
second
So
and
how do we perform
profoundly
this
important
fine-tuning
anatomical
correctly?
area.
This is a two-step process, and it should take about 2 minutes in total. For step number 1, you will gently take hold of your manhood with your thumb and
what
forefinger.
is the
Position them on
perineum?
either side of the corona, on that distinct ridge. Now, you're going to
It's a
apply
term we
light
use
pinch.
in
It should be
urology
firm
and
enough
physical
to feel a
therapy
definite
all
pressure,
the time,
but it should be
but it
comfortable.
very
You're
rarely
going to hold
comes
that
up in
gentle
everyday
pinch for about 5
conversation.
seconds. 1, 2, 3, 4, 5. And then slowly release the pressure completely.
It's a
Wait a
very
second,
small piece
and then
of real
repeat.
estate,
Gently
anatomically
pinch and
speaking,
hold for 5
but
seconds.
its location
And then
is everything.
release. You're going to repeat this hold and release action for roughly 1 minute. This rhythmic patterned pressure is
To
exactly
locate
the
it
kind of stimulus
precisely,
that helps to
the
wake up and
easiest way
recondition
is to sit
those specialized
comfortably
nerve
in a
endings
chair
without
or
overwhelming
lie
them.
back
For step
with your
number 2,
knees
after about a
slightly
minute of the hold and
bent
release
apart.
technique, you are going to switch to a different motion. Keeping your fingers in the same position, you will now switch to
If you
slow,
place the tips of
gentle,
2 fingers in that
circular
area,
motions
you'll
around the
immediately
entire
feel
circumference
what
of
I'm
the
talking
corona.
about.
Let your fingers glide smoothly over the ridge. The goal here is to stimulate all of the nerve endings
But when it
around
comes
that
to
entire
erection,
ring,
strength,
not just
control,
in one spot.
and especially
The second minute of
longevity.
gentle circular work helps to wake up the sensory pathways even more, encouraging faster and more efficient signal transmission between
But
your
there is
penis
one
and your
muscle in
erection command
particular
center and the
that
spinal
sits
cord.
directly
A patient of
underneath
mine,
this
a
spot that we
72-year-old
need to
gentleman named
focus
Robert,
on.
who was
It's
a
called
retired
the
accountant,
bulbus
found this
spongiasis
final
muscle.
step to be the most impactful for him. He was a very methodical man, and he
And
followed
she
the
wrote
routine
down
precisely.
his exact words
After
for
about
me.
3 weeks,
he said,
he told me something
"Tell
interesting.
the
He
doc,
said,
it
"Doctor,
was the first
it's not
time
just the
in
morning
nearly a
erections that have
decade I
returned,
felt a
which they have. It's that my body's overall sensitivity has changed. Arousal feels more natural
hum
and spontaneous
of life.
again, the way it did
That's
years
what
ago.
this can do."
That is the power of reawakening these nerve pathways. And for a final synergy tip, the benefits of this routine are compounded
Try
by a
doing this
healthy nervous
routine
system
in
overall.
a warm shower.
This means managing stress, which can dull nerve sensitivity, and ensuring you get enough B vitamins in your diet, particularly vitamin B12, which is essential for nerve health
This
and can be
primes
found in
the
foods
entire
like fish,
area,
meat,
making
and
the
eggs.
stimulation from
Supporting
your
nerves on
thumb
the
that
inside
much
makes
more
this external
effective.
stimulation even more effective. So there you have it, a powerful, intentional sequence designed to work
If you
with your body's
understand
natural
the
systems,
power of this
not against
ignition
them.
switch, and
You
you're
start
ready
with the
to
base
finally
groove to
turn the
ignite
key
circulation.
on your own
You move
health.
to the perineum to engage that crucial muscle support, and
Let
you
me
finish
know
with the
that you're
glands
with
ring
me
to
on this
fine-tune your
journey.
nerve communication. And the best part? The entire routine. It takes less than 8 minutes of your day, but knowledge without action is
This
just
crucial
entertainment.
step
So
is
before
what
you click
translates
away,
that
here is
initial
your simple
spark
action
of
plan,
energy
your
into
doctor's
real,
prescription, if you will, for
sustainable
this coming
power.
week. First, for the next 7 days, I want you to commit to this 8-minute sequence every single morning. Ideally, before
Pressure
you even get
point
out of bed.
number 2,
Just make it part of your
the
waking up
perineum,
process.
the
Second,
powerhouse muscle.
make a conscious effort to stay well hydrated throughout the day. This is absolutely
This is an
fundamental
area that
for
might
healthy
be
blood volume
completely
and
new
optimal
to many of
circulation.
you.
You cannot build a strong house on a dry foundation. And third, Add just one nitric oxide-rich food to your diet each day.
And that's a real
It can be as simple as a handful of
because
spinach in a
understanding
smoothie,
it is
some beets with your dinner,
fundamental to
or a few walnuts for
understanding
a
your
snack.
own
Small
body's
choices
mechanics.
create big changes. Now, I know what some of you might be thinking. Doc, is this really going to work overnight? Is this small routine really
Higher
enough to make a
region
difference?
is the single
Let me be
most
very clear.
overlooked
This
spot
is not a magic button.
in all
Your
of
body is a
male
complex
pelvic
system,
anatomy.
and it needs time to respond, to retrain, and to heal. Many of my patients start noticing subtle, encouraging changes. A bit more warmth,
This small,
a feeling of fullness,
unassuming
erections
area
that last
is
just
an
a little longer.
absolute
Within 2 to 3
powerhouse.
weeks of consistent
Not
practice.
understand.
The key word there is consistent. So please, trust the process, and on the note of safety. The beauty of this
So
technique is that you are
why?
in complete control.
Why is this
Your body
unassuming
is the
patch of
expert.
tissue so
Listen to it.
absolutely
The
vital
sensations
for
you're
your
looking for are
performance
warmth,
and your long
a pleasant fullness, or a gentle tingling? Never sharp pain. If you feel any real discomfort, you are simply pressing
Its
too
contraction
hard.
constricts
ease
the
up.
deep dorsal vein
Gentlemen,
of the
remember
penis.
why we're doing this.
This is the
This is about
primary
so much
exit
more than
route
just a
for
physical
blood.
function.
The muscle
It's about
acts as
waking
a
up in the
natural
morning,
valve,
feeling
a
confident,
biological
feeling in
clamp.
control of your own body. It's a powerful reflection of your overall health and your commitment to living a vital, strong, and independent life for years to come. Your future self is counting on the small, positive choices you make today. So if you are ready to take back that control and you want more science-backed, no-nonsense advice just like this, I invite you to hit that subscribe button so you don't miss what's coming next. And more importantly, to May-comment self. I want you to go to the comments section right now and write 2 simple words. Day 1. This isn't for me. This is your public declaration, your starting line. It's a powerful way to hold yourself accountable. Let's start this journey together. Thank you for investing your time and attention in me today. In my next video, we'll explore 3 common breakfast foods that you might be eating right now that could be secretly sabotaging your circulation. You won't want to miss it. Until then, remember, your health is your greatest asset. Take control of it.